Hello, good afternoon, everyone. Welcome to today's training, Workplace Violence and De-escalation Techniques. My name is Jonathan McDowell, and I'm the Business Intelligence Manager at the Nevada Primary Care Association. And may I have the next slide, please? The Nevada Primary Care Association provides training and technical assistance advocating for local, state, and federal policy change and creating economies of scale through program management to the Nevada Federally Qualified Health Centers, or FQHCs. The FQHCs offer all Nevadans exceptional medical, dental, and behavioral health care services. So, the Nevada Primary Care Association has two upcoming trainings, an eClinical Works pre-conference starting September 19th, and we have the Nevada Primary Care Association 2023 Annual Healthcare Conference, September 20th through 21st, and that's going to be held here in Reno, Nevada. For additional information regarding our PCA, upcoming trainings, or to subscribe to our newsletter, please visit us at nvpca.org, or please feel free to scan the QR code listed on this slide. This training is being hosted by NVPCA and Connect Consulting Services. I want to thank Connect Consulting for partnering with our PCA to offer this training. I will now turn the presentation over to today's speaker, Rebecca Kynes, to introduce herself and Connect Consulting Services. Thank you.
Jonathan. Hi there, my name is Rebecca Kynes. I am the Senior Planner with Connect Consulting Services. We are a consulting firm based in Sacramento, California, and our focus is on emergency preparedness and training for pretty much any entity that needs it. We do work in a wide variety of organizations from public to private. I do have a history in emergency management as a emergency management coordinator for the city of Arlington, Texas, where I worked on many mass gathering events and planning events, as well as pandemic planning and training as well. I do have a bachelor's degree in criminal justice, but went the other route in the emergency management response side versus more on public safety side. So I'm so thankful to be here with you today and to be able to deliver this training to everyone. So a little bit about, real fast before we get going, just so you know that this training is being recorded. So everything that is said is recorded and will be available after the training is complete. We also have all attendees in mute mode. If you need to ask a question, please feel free to type that into the question section. It should be in the toolbar, the go-to toolbar, which should show up on the the right side of your screen. You could also raise your hand if you would like to ask that question out loud, and when we get to a stopping point, we can do that. We do have a couple of spots for questions in the presentation. And then lastly, this presentation is available in the handouts section of your go-to toolbar. You can download it. It is in its PDF version. So let's talk a little bit about the training purpose today. So the purpose of our training today is going to be in regards to workplace violence. So I know that when you think about workplace violence, sometimes you think of external factors, but we're also going to focus today on those internal factors that can cause workplace violence and can cause just an unsafe or an unhealthy work environment for many individuals. And so we're going to give some information on how you can assist through in your healthcare environment and to provide the support in that workplace, but also so how you as a leader in your workplace can provide support, and also maybe just a few examples to kind of go through and think about and how you would maybe respond in those cases. So I know also, I'll say from the beginning, a lot of times when you think of workplace violence, I think people tend to kind of think about that active shooter type situation, because I know that is something that is first and foremost in a lot of individuals' minds these days. So we're looking at this from an all hazards perspective, not just a disgruntled individual coming into the workplace. We're talking about daily workplace experiences. So these are the objectives we're going to go through today, and we're going to describe what workplace violence within healthcare means, describe organizational and environmental risk factors that can cause that workplace violence. We're going to describe some avenues that you can take internally and externally for support, and then describe the steps that it takes to implement a comprehensive workplace violence prevention program. So what you can do as a organization to help foster a safe workplace for your staff, and what that prevention and response program would look like. Okay, workplace violence in healthcare. Here's some statistics. This comes from the Bureau of Labor Statistics as workplace violence relates to healthcare. And if you see over there on the chart on the right-hand side, the overall private industry has less than 5 in 10,000 workers rate of workplace violence. However, hospital and nursing and residential care facilities have a higher number, over 15 and 20 individuals per 10,000. So workplace violence is really known as any act or threat of physical violence, harassment, intimidation, or any type of other threatening or disruptive behavior that occurs within the worksite. Between 2016 and 2020, there were 207 deaths due to workplace violence incidents within healthcare. And in 2020, for every 10,000 healthcare workers, 21.8% experienced workplace violence. That is a really high number of individuals when you really think about it. And we have to kind of look at that in terms of what happened in 2020. What have we been dealing with in the healthcare industry since 2020, and how that might reflect on those individuals in that healthcare work environment. Some national statistics just in general. For every year, more than 2 million Americans workers report being victims of workplace violence. And that has a cost to employers of more than $120 billion a year. So this is in according to some recent estimates by the National Institute for Occupational Safety and Health. However, when you look at this according to the Bureau of Labor Statistics, 20,870 workers have experienced trauma or some sort of non-fatal workplace violence in 2019. Of those victims who experienced trauma from workplace violence, 68% were female, 65% were between the ages of 25 and 54, 70% worked in healthcare and social assistance industry. Of those, 21% required 31 or more days away from work and to recover, and 20% involved 3 to 5 days away from work. So as a leader in this workplace, you may be thinking to yourself and understand that anytime you have staff out of work, that is a cost to your agency, whether it be in overtime, backfill, whatever it may be, just loss of revenue in general, because you're not able to see the number of individuals that you would with a full staff. So that is where that cost to employers comes in, and that is, it's just loss. It's just a loss. So those national statistics, as they play out for healthcare, our healthcare workers are 4 times more likely to have time away from work due to workplace violence versus any other injury. 75% of all workplace violence incidents do occur in a healthcare setting. That's a high number. That's a very high number. 54.2% of nurses have experienced some type of verbal abuse from patients, and 29.9% have experienced some sort of physical abuse. I think we think about this sometimes that it's just part of the job, and that's really not necessarily true. It should not be considered part of your job. I think a lot of individuals that work in some sort of public safety, public health type environment, they feel like taking physical or verbal abuse is something that they just have to do as part of their job, and that really should not be the case. The National Crime Victimization Survey shows healthcare workers have a 20% higher chance of being the victim of workplace violence than other workers. And the American Hospital Association has found that healthcare systems have spent over $1.1 billion in security and training to help prevent violence within facilities. Those are all very, very high numbers. So what are some of the consequences of workplace violence for healthcare organizations? low staffing that requires extended shifts and overtime requirements, which then in turn lead to workplace violence. So you kind of end up with this vicious cycle of the low staffing causing workplace violence, causing the individuals to feel overworked, and it just kind of keeps going because then you have that loss of staff, which then causes lower staff, extended shifts, and it just keeps going. Workplace violence leads to an increased absenteeism, lower productivity, lower morale, and increased work transfers. So when people aren't enjoying being at work, you get that lower morale, which then turns into lower productivity, which then turns into increased absenteeism, which then turns into those extended shifts, overtime requirements, and so on and so forth. The violence causes major disruptions to job satisfaction, can have a negative impact on the workplace and the healthcare facility. And that's not just for your staff, but those negative impacts can roll over into your individuals who are coming to your department seeking assistance. And they can tell, oh, this person doesn't want to be here, this person doesn't enjoy their job, which then can lead to them feeling a little bit disgruntled for being there or having to deal with an individual that maybe isn't necessarily enjoying being there for the day. And then workplace violence often leads to these healthcare workers leaving the profession, which makes for an increased cost to that healthcare organization. Because again, you go back to low staffing, extended shifts, overtime requirements, and that all can continue to lead and compound that workplace violence. So what can you do to protect your workers? Regarding workplace violence, we're going to go over some of the things that all employers should do to help protect your staff and employees. Have a written zero tolerance policy towards workplace violence. Make it very clear that you support your staff, whether that workplace violence is coming from an individual who is visiting your facility or it is coming from other staff and other members of your organization. Have a zero tolerance policy for it. You will take action anytime it is reported. Develop a workplace violence prevention program if you do not already have one in place. A program which we will get into just a little bit more in those details. That program is going to help your staff know that you are there to hear them. You are there to support them and that you are there to protect them and that they have an avenue for reporting any type of workplace violence that they may experience and that they have an avenue of support if they do become a victim of workplace violence. Provide workplace violence training, emphasizing on the different aspects of the program, what risks to look for, what and how to report it, and then what to do in an actual incident. Make sure that your staff have the tools they need to respond to a workplace violence incident. And then encourage the reporting of any types of concerns or any specific workplace violence incidents, whether they were the individual involved or not. If they have seen an example of workplace violence taking place within your organization, make sure that everybody involved feels free and comfortable to report without feeling like they may be it may be used against them. Make sure that reporting is easy and potentially just confidential. Maybe have a way for those reports to be made to your leadership staff so that they can feel safe in making those reports. And then maybe consider using an outside expert to provide threat assessment training, physical security upgrades that may be needed, just something that so that your staff feels like they're being taken care of. And that individuals do tend to respond better when training comes from somebody with outside of your organization. That way they don't feel like they are just having to sit through another training and listen to another leadership say something that needs to be done that maybe they feel isn't going to be executed. And I think, Nevada PCA is doing that today by bringing us in to help give you guys some examples and just some food for thought when it comes to actual workplace violence training. When you look at regulations and requirements that your organization must have, there is a general duty clause in the OSHA Safety Health Act, which requires all employers to be responsible for adhering to OSHA's general duty clause, saying that all employers, regardless of size, must provide a place of employment free from recognized hazards that are causing or are likely to cause death or serious harm. That just means that your employer is required to make sure that you are working in a safe environment. If they don't know about it happening, then they can't do anything about it. That's why that a reporting tool is so important, so that your employers know what's happening behind closed doors, what's happening in the break room, and that they can take action. There is also workplace violence prevention for healthcare and social service workers is a federal regulation. And then many states, for example, California's Code of Regulations, Title 8, does require and have specific laws that are related to workplace violence prevention in healthcare. And I'm sure Nevada has those specific laws as well. So are there any questions about just this first part as it pertains to just those kind of requirements? I'm going to kind of go through. If you have any questions, you could raise your hand and I can unmute you. I see Holly Heath has their hand raised. I'm going to unmute you. Holly, do you have any questions? You are self-muted, so you'll have to unmute even though I've unmuted you. Nope, hand down. Okay. Maybe you accidentally put the hand. Oh, no, hand down. No, hand down. Okay, it's very sensitive. I don't see any other hands up, but I do see that the question, let's see, question from my team channel. How likely am I to experience workplace violence? Are those in admin at lower risk? What constitutes as violence? Is it unwanted physical contact? Okay, so those are actually questions that I think that we're going to answer as we get more into the presentation. But we can always reference back on, and I can answer these questions. I'm going to go back to our statistics on how likely am I to experience workplace violence. As a healthcare individual, you have a 21 in 10,000 chance, 10,000 individual chance of experienced workplace violence. That means you have a 70% chance that as a healthcare worker or anyone in the social assistance industry will experience workplace violence. Are those in admin at lower risk? I would say those in admin are not necessarily at a lower risk, maybe a different risk, because your risk is going to be different than frontline workers or frontline individuals who are working with patients and visitors to your facilities who are going to have a different risk level. Admin individuals could, and I'm thinking of admin as your leadership staff, administrative individuals. They're going to have, their risk is going to come with a higher risk from within the organization because they're working more with maybe a disgruntled staff members versus disgruntled visitors. And what constitutes as violence? We're actually going to get onto that definition here in just a moment, but I would tell you briefly, violence is any unwanted or disgruntled act. It does not have to be physical. It could very, very well be verbal. It could be emotional, and it can be physical ultimately. But as we get through the presentation, we're going to go over some of those definitions. And then in the end, if we haven't maybe answered those questions as clearly as you're wanting, then let's come back to that question. Okay, so how can you support your healthcare workers? So factors for healthcare workers reporting incidents. Like I said earlier, a lot of times workers feel it's part of their job. Facilities might have inadequate policies, maybe no procedures or training or support. It's hard to think in this day and age that there is no policies or procedures or no training, but we do still come across a lot of organizations that have nothing out there to support their staff. And maybe those reporting procedures are kind of complex. Maybe there's a lot of red tape, a lot of hoops that they have to go through, and so individuals don't feel quite as free to make those reports. Maybe they see a delayed resolution due to frequency and lack of responsive reports. So I apologize, my allergies are bothering me a little bit today. Maybe individuals are seeing that people are reporting, but then they're not seeing the resolution. And that could be for two reasons. It could be because the organization is not providing resolution, or it could be because the resolution was done internally and between the involved parties and not shared amongst the organization. But nonetheless, they're seeing that delayed response, which is making them think, why would I report whenever nothing's being done? Then there's also that fear of retaliation or the belief or lack of accountability by leadership. Maybe they've seen it reported and leadership has said, that's not a big deal. You can ignore Sally. She's just having a bad day. When ultimately Sally is having that bad day over and over, which is now making Susan's day really bad. And it can be seen as a form of workplace violence because it is maybe passive aggressiveness is really probably the most common form of workplace violence. It just makes for an uneasy and uncomfortable work environment between individuals. So what are some methods to support healthcare workers in that workplace violence organization? Leaders should encourage the use of an employees assistance program. So some type of program that is there that tells your employees, this is what we are going to do to support you. Organizations should also utilize local resources to provide services to healthcare workers. If you have been a victim of workplace violence, lots of times you may need some external support, maybe in a form of counseling, maybe in a form of legal representation. But your organization as a whole should be supporting their staff and saying, these are the resources available, and this is how we are going to help support you in the response to a workplace violence incident. Organizations should also provide adequate time off to allow your healthcare workers to receive the support they need. If your staff has been a victim of workplace violence, then they're going to need time off to process that. And really and truly, as a organization, you need to have some standards, some minimum standards that are allowed to say, hey, this is what was experienced. We're going to give our staff 10 days off, 20 days off. It just depends on what the incident may be. And then each one of those incidents could be looked at individually. And that way you could provide additional support, additional time off, additional counseling, whatever it may be that your staff needs to feel supported in a workplace violence response. The leaders should also assist healthcare workers with that reporting process, both internally and externally. So don't just say, here's the document, you need to fill it out. Maybe they're experiencing some severe trauma. And so you need to help them get through those steps of filling out response documents and filling out, maybe it needs to be a legal report that's made to law enforcement. Help your staff get through those steps. Don't just leave them out there on their own to process that trauma that they may have experienced. And other methods have that zero tolerance workplace violence. That could include environmental hazards that are identified and methods to address those. So maybe you know that there is an external hazard, an environmental type hazard that your staff feels makes them vulnerable to a workplace violence situation. And if that's the case, have a method to address that and maybe a way to work around that environmental hazard. Establish a code of conduct that defines and manages those disruptive or inappropriate behaviors by all staff. That could be, we aren't going to allow any type of joking around or, you want to make sure that you've set those boundaries. We aren't going to allow any type of harassment or any type of verbal discussions that could be seen as threatening or harassing to individuals of your workplace, and have that set as part of your zero tolerance policy. We will not allow you to use certain words because those words make other individuals feel unsafe. We will not allow you to be unaccepting of individuals who are maybe different than you are. So maybe really laying out that you're going to be tolerant of different individuals within your organizations who may be different religious, different genders, different race, whatever it may be, and really lay it out there that these are zero tolerance items. We are not going to tolerate you using any of this in a threatening manner towards anybody else within our organization. Develop an identification system for potential violence. This could be something when it comes to an external individual. you know for a fact that this individual comes in for care on the third Thursday of every month, and they tend to be a disgruntled individual for whatever reason. Maybe they themselves have a disability that just really require or prevents them from making good choices, such as a traumatic brain injury. We all know that a lot of times traumatic brain injuries do change an individual's personality. So really flagging that this person is coming in for treatment on this day, so everybody is prepared for them. Maybe they've had a violent tendency towards a certain staff member, and working to prevent that staff member from having to be exposed to that individual. And that's not only going to save your employee, but it's going to help to make the interaction for the individual coming to your facility be a lot smoother. And then just knowing that threats of violence must be acknowledged and addressed by management. Anytime that individual of management knows that there is a threat of violence in any form, addressing it, making sure it's handled, making sure that your staff knows that it has been addressed and handled, and that your staff is aware of how to move forward with an individual that has created that threat of violence. And then having a post-incident response method. When you want to make sure that your staff is aware of what to do after an event has happened. There's many reasons that you want to document what has happened post-incident. Document everything. Make sure your staff knows to document everything. Report any injuries, no matter how minor they may be in the moment. You could say, oh yeah, they just slapped me. I'm okay. It didn't really hurt, but I'm okay. No, you need to document that physical contact was made. Seek any resources as needed. Does that mean you need to bring in outside legal, law enforcement, maybe file a report through law enforcement? Maybe you do need to bring in legal. Maybe you do need to bring in some type of counseling for those involved. Work with those criminal justice authorities. Work clearly with them. Make sure your staff is aware that you have every intention to work within those with those criminal justice authorities, because then they know that you are there to support them. What is that employer responsibility? Make those resources available to those involved in the incident. Make sure that they know that they're there. Support that reporting. Support workman's compensation reporting, and help them through that, because those types of reporting can sometimes just be too much for an individual who has experienced some trauma. So help them work through that to make sure that they are getting everything that they are entitled to and everything that they need to be able to recover from an incident. And then ensuring and ultimately that your healthcare worker is safe, that they always feel safe. That is going to be priority. And then do a debrief. Once that event has taken place, not necessarily the same day, but within a couple of days, we really recommend that within the first 3 days that you do a debrief, because after that point, individuals tend to forget what information is, or information kind of gets a little skewed in their memories. So it's really important to do that after action debrief. And what it should do is really focus not only on the person involved, but also on the incident investigation, like the incident as a whole. And then you're going to take that and create a report so that you can determine some corrective actions. Not everything works perfectly every time. So what took place in that incident response that maybe you need to change? Maybe you've never had an incident that you have to respond to, and so everything on paper looks like it's great and it's going to work out great. But then once you actually go through the process of responding to an incident, you realize, oh, maybe that call tree didn't work the way we thought it would. Individuals did not respond to whatever code gray or code silver, whatever your different codes may be for a workplace violence threat. Things they weren't aware. Maybe there was a lack of training. Maybe you have some new staff and they didn't get the training on part of their onboarding, and it's not time for your 6-month or your 12-month training, and so you've missed individuals that need to know that information for a response. All of those items are going to be rolled up into that debrief and that what we call an after action report. And then that's going to help you to establish how actions were truly implemented during the response. Find those gaps and those contributing factors to those gaps, and identify the areas of improvement, and then determine the actions or the steps needed to make sure that in the event you have to respond again, that you've made corrective actions and that you hopefully won't have the same deficiencies that you had in the initial response. And really go through that post-incident analysis. This is really where you're going to have that chance to examine the incident with identifying those goals of those vulnerabilities and then address them to prevent that reoccurrence. Your review should really cover the following areas: power dynamics from both the assailant and the assaulted. What was the dynamic that caused it to happen to begin with? De-escalation tactics, intervention strategies. Did they work? Did they work as you had trained and planned? The roles of all of those involved, were they necessary roles? Were there maybe additional roles that you need to work into your plan? Healthcare workers' perspective of the support provided. Did the individuals with maybe the assaulted, did they feel like they got the support needed post-incident? And then overall, just that lessons learned. I mean, this is not something that's going to happen quickly after an event, but it should happen within 30 to 90 days post-event, so that everybody can kind of sit down and round table it and talk about what worked and what didn't work. Okay, do we have any questions about that portion? Okay, we're going to talk now about building a comprehensive workplace violence prevention program. So it's important that your programs start off with a mission statement. This is an example of a mission statement. It's our policy to promote a safe environment for our employees and the visiting public, and to work with our employees to maintain a work environment that is free from violence, harassment, intimidation, and other disruptive behaviors. Quite simply, this just lays it out there, and it says this is what we are saying that we will do. We are making it our mission to provide these things for individuals who are within our organization or within our facilities. I think it's a great way to start off to show your staff that you support them and that you have a plan for a course of action. And then you can start building a sustainable program. Some of the keys to a successful workplace violence program is having that management commitment. Having your management staff, your leadership staff say, no, we want to be a part of this. We are committing to you that we will own this, that we need to have this, and that we will be there to help support you. But then also bringing in employee involvement so that they have ownership over the program. A lot of times we have regulations and rules that we have to put in place that, everybody gets inundated with, and they're like, great, another thing that we need to think about, another thing that we need to plan for. But it's really important that when you have that employee and management commitment and involvement, then they all take ownership over that program, and they are all buying into that program as something that they support and that they will encourage within the facilities. Doing a worksite analysis. If you have multiple locations, you may have a different worksite analysis for each one, which means your response could be very different for each location. Hazard prevention and control. Like we said, that could just be that flag that pops up on an individual's file that says they're coming in today. Let's be prepared for the fact that they are usually disgruntled in one way or another. And we can do everything that we can to mitigate against them being disgruntled when they come in today. And then that safety and health training. As always, a document or a plan is only as good as the training that goes along with it. If you write it and set it on the shelf, nobody knows about it. Nobody's ready to implement it in the event that it's necessary. So having that safety and health training as part of your onboarding training, as part of your annual training, or just available maybe through recordings or something of that nature, where individuals can go in and refresh their memories on what those programs are, or have your new staff go through it. It's very important to make sure that you have a training plan in place. And then record keeping and program analysis. That's going to be making sure that you are staying fresh on your training. Has it been done this year? Have you revised your program this year because maybe you have increased staff or taken on a new program within your facility that needs to be documented in your plan? Maybe you have moved to a new facility, and so your work site analysis needs to be updated. And it's just really setting forth in the beginning what your intentions are for your plan, and your intentions for training and upkeep and maintenance of that plan are going to help make sure that everything stays on track. Part of that management commitment and employee involvement is really that it begins with management recognizing the hazards, monitoring incidents, taking those measurable corrective actions, track incidents. This can take a lot of time, a lot of energy, and everybody's busy. But really having somebody that says, it is my commitment to track these incidents and make sure they go all the way through the process, and that everybody involved receives everything that they need from us. And then having those champion and encourage the reporting of incidents. That would be those individuals that see something, we say see something, say something. So if you see something happening, say something to the individual. Don't be scared to reach out to them and say, hey, I saw this happen, and I want to make sure that you feel comfortable and safe, and that you're reporting anything that you feel needs to be reported. And if it is something of a level that they don't feel comfortable reporting, but you want to go and report it for them, feel free to do that, because that's the way individuals know what's happening, and your leadership can take those corrective actions. And then for that employee involvement, recruiting employees to participate in building the program. Let them see it through from the beginning. Encourage those locker room conversations or water cooler conversations about the program. What do you think would work? Where do you feel the most vulnerable? And use those vulnerabilities as you're building your program. And then communicate that commitment. Have those maybe not daily huddles, but talk about it. Have the round table discussions with your healthcare workers, posting signage everywhere. Maybe your mission statement is posted in multiple locations within your facility, so that people are reminded that you are committed to making sure that they have a safe and healthy work environment. And then maybe something as simple as posting a anonymous reporting link, a QR code that they can just scan real quickly and report from their phones. Maybe a kind of a Google document, something of that nature, that they can just fill it out, say, this is what I saw today, these were the individuals involved, and it goes to that person that's in charge of tracking those incidents, and then they can reach out to those involved and say, hey, this was reported, I just want to make sure that everything's okay. Maybe somebody just walked in on the tail end of a joke and didn't realize that it was a joke, and didn't realize that it was just friendly banter between individuals, and they took it as something a little bit more intense. It doesn't hurt. It does not hurt to reach out and make sure that everything that is being seen is actually safe and a healthy environment for individuals. Conducting that work site analysis, management should commit to hiring a consultant to come in and do that analysis. Maybe that means surveying staff, doing interviews with staff, walking the facility, doing a site assessment, to see where those deficiencies may lie from the beginning. And then that comprehensive work site analysis is going to identify those strengths and weaknesses. Maybe you've got individuals on your staff who have already been through some sort of training, and those strengths can be used to implement into your program and to really provide a good, strong program. And then utilizing your local resources, such as your local emergency management department or public safety departments. These are all individuals who have worked in this environment for a long time. This is their job. This is what they do on the daily basis. And so bring them in. Maybe they have some free training. I know in my local community, our sheriff's department offers a lot of free trainings for a program that they support for when it comes to workplace violence, and teaching individuals how to defend themselves if needed, and if it was a response that got to the point of physical safety was threatened. And so reach out. Don't reinvent the wheel. It's there for you to use, and that's what they're there for, and they want to help you, and they want to be a part of your plan, because it may be that those police and fire departments that are responding to your facilities, they need to know what your plan is, so that when they get there, they are working with you and not working against you. They know what your evacuation plan is. They know what you're going to do if you have to shelter in place because of a threat. So it's really important to make sure that those plans are shared so that they can be a part of that plan when it rolls into their response aspect. So once that worksite analysis has been conducted, really take those results and create a plan to address all the hazards identified, and then put into place certain controls for those hazards. You should also make a timeline of the plan. Share that plan with healthcare workers. And what that means is you've identified where the risks and where the threats are. Now you're going to make a plan so that they understand, hey, we're working through it. Not everything is going to be fixed overnight. Not everything is going to be taken care of immediately, but this is our timeline to address those issues and to make sure that they know, so that they're not sitting back having their own water cooler conversations of, well, they did all this work, but nobody's doing anything now, when in reality you are. So it's just very important that you keep those lines of communication open so everybody knows that everything is moving forward. And safety and health training. So once you have identified where those deficiencies may be, where your threats are, bring in the training that is specialized for your organization. This can be provided internally, it can be provided externally. If you have a training person on staff, use them. Use them to help build your program and to implement that training. For instance, maybe a Crisis Prevention Institute provides a train the trainer course. Send an individual to that train the trainer course so they can come back and they can provide that training to your staff and to your new staff as they come on board. And determine the best path for training healthcare workers to the level that they need to be. Does a call take individual need to be trained on in the personal, to the same level that those deal with individuals on a personal level? No, not necessarily. Does leadership staff need to be trained on everything? Yes, because they need to know what every single individual within the organization could be dealing with and the different aspects of their job. And then have that record keeping and program analysis. Once the program begins to be developed, when do you plan to evaluate the program? Put those dates into a table that says, okay, every 12 months from the initiation, we are going to go back through and double check and make sure all this is good. Go through the data collection. Have that program committee go through your data collection and display that data. Make sure that all your staff understand what the threats are. They may not know. You know, it may be that Sally comes to work every day and she had no idea what they're dealing with at the front desk and the amount of disgruntled individuals they deal with over in scheduling or whatever it may be. Make sure everybody is aware, because that will help with that tolerance level amongst staff as well. And then ensure that your data is consistent and concise. You want to make sure that your collection methods are always the same. And then when areas of opportunity are identified, create a plan to address them. You may not think of everything at the very first time and the very first go around of your plan, but as things do come up and as things happen, enhance your program. I think I just lost my AirPods. So if you can't hear me, let me know. But make sure that you go through your program and update as necessary. You may need to make specific changes that you were unaware of when you originally made your plan. I'm going to give you just some resources and some maybe some different areas for education when it comes to workplace violence planning. OSHA is always a great place to start. They have a lot of resources available. There's also different workplace violence prevention for nurses, NIOSH, FBI. These are all great links to follow to get any type of resource, education type materials that you might need to help build your plan and to help provide a safe plan for your employees. Gosh, I feel like that went really quickly. That was a quick 45 minutes. Does anybody have any questions or anything that they want to talk about before we close out today's training? Jonathan, do you feel like we answered the questions that you posed in the very beginning?
Yeah, I believe so. I was writing Brandy in the background, and every time I had a question, you answered it almost immediately after.
Perfect, perfect. Did anybody else have any questions or maybe even just any statements? Thank you all again for attending today. I really, really do appreciate it.
Yeah, and thank you so much, Rebecca. And thank you everyone for attending today's training. You'll receive the survey as mentioned. We'd appreciate it if you complete the survey and provide feedback. If you have any questions, please feel free to reach out to me at jmcdowell@nvpca.org. So jmcdowell@nvpca.org. On behalf of the Nevada Primary Care Association, thank you for joining us and have a great rest of your day. And thank you again, Rebecca.
Thank you. Bye.